Okay, can I request everyone to put their video on and then we can go live now. Kipruto, video. Kipruto?
Oh.
Kipruto.
Okay, so how are you going to start?
We are live, everyone. Just give us 2 minutes to let the rest of the team join, the other participants, and then we will start. Hello, everyone, and welcome to Covering COVID-19, from policy to satire to images of death. I wanted to introduce the first of a series of webinars that the Aga Khan University's Graduate School of Media and Communications will be hosting over the next few weeks in an effort to showcase the work that our students from the Master of Arts in Digital Journalism have put together and contextualize this work to the current pandemic. We want to give you a series of useful tools, engage your intellectual curiosity, and provide opportunities for dialogue on current events. We're excited to have you here. If you have any questions as we go along, please feel free to use the Q&A box at the bottom of your screen. I'll now pass over to our host for the day, Mercia Diambo.
Hello, everyone. Can you hear me? So today we have this very interesting conversation, and we'll be talking to some of the students from Aga Khan University who graduated with their Masters in Digital Journalism, and I'll just introduce them briefly and tell you what they have done. And then from there, we'll proceed with our discussion on some of the impacts that their studies could be having on the coverage of coronavirus and some of the lessons that they can pass to us even as we continue to cover coronavirus or as we continue to watch news on the coverage of coronavirus. So I'll first start by introducing Patrick Gadara, and Patrick will be talking to us. Hi, Patrick. Maybe you can.
Hi, how are you?
I'm fine, thank you, so that they can know who you are. So I believe Patrick will be talking about how the online environment has influenced ethical decision making with regard to graphic images. So you'll be talking to us about that. And then we have Kenneth Kipruto, sub-editor at Standard Media Group. And Kenneth will be talking to us about how we can use satire and cartoons to talk about different issues that are affecting the country. And because people think that covering an issue like coronavirus or health can only be done using the serious and straight news, but then we realize that we can also use things like satire, we can use things like cartoons to tell people about how the coverage of coronavirus is being done. And then we have John Girashu, who will be talking to us about the Big Four agenda and how it can come into the coverage of coronavirus. So welcome to our panel today. We also have Joe. Hi, Joe. So Joe will also be helping us as a veteran to put all this into context and maybe nudge the direction forward on what we need to do when it comes to covering coronavirus. Have we gotten it right? What are some of the missing links? What are some of the things that we can add as journalists, as policymakers? I know that in our list of participants, we have policymakers, we have medics, we have journalists, we have students. So I want to believe that this will be an interesting conversation where we draw from the different pots that we come from, and then we make a very interesting stew on the coverage of coronavirus. Welcome. So let's start off with Gadara. Can we start with you?
Yes. I'm quite happy to start.
So, maybe
all right.
You can just tell us briefly on what you think the coverage has been so far. What is your opinion on the coverage of both locally and internationally in terms of print, TV, digital? How has it been for you, and what do you think we need to do differently?
Thanks a lot for having me. I think obviously the coronavirus pandemic has hit mostly outside of Africa. So we can only for now really speak about how it's being covered in those places.
Yeah.
And I think for me, my specialty was looking at the use of graphic images and in coverage. And I think that if you look around the world, you've seen an increase in the use of these sorts of images, especially in places where we are not used to seeing these images. So if you think of the US, for example, there's been lots of articles recently written commenting on the fact that there are many more people who are utilizing images of dead bodies, dead people. Of course, it's not on the scale that we saw, for example, with the Ebola crisis, where it was very vivid and very in your face. Here you've got much more respect towards bodies, much more. They're being pictured in situations where they're covered up in a morgue or in a freezer van, so unlike what we had seen in West Africa during the Ebola crisis. I think for me, I just mentioned a few things that I found from my study, which I did last year, which is basically when it comes to our use of graphic images, Kenyan editors tend not to use too many of them, Kenyan newspapers and outlets. And I think that, according to one study, I think it was just 5% of our of coverage, especially on security issues that utilized graphic images. So they're not as prevalent in their use here. And I think editors do take a lot of concern when they think, when they consider the ethical implications of using them. But one of the things I found was that they don't have any systematic ways of determining how to the ethics of using it. So people rely mostly on their own intuition, on what they think or what they feel to be correct. And also they do a bit of consultation with their peers. Now, this has implications, I think, when it comes to reporting on COVID that we shouldn't ignore. Because if indeed we do end up getting many deaths from COVID, then the papers will have to deal with the issue of, do they show these deaths? You know, the TV as well, you know, they'll have to, editors will have to make these decisions. And on what basis will they make these decisions? I think they need to really start thinking about that at the moment, you know, before we actually get to that. What will be the purpose of the reporting? Will it be simply to portray the situation, or do you want to also influence how people behave? If you want to influence how people behave, then you might consider that if you're using images, then they might have an impact. So for example, we saw during, remember during the 2007 violence, post-election violence, newspapers got together, editors, and decided to show some or to publish some of the really gruesome pictures that came out of that in a bid to kind of shock people into stopping the violence. Would they think that, similarly, that if we show bodies of people dying from COVID, that Kenyans will take the disease more seriously? So these are some of the things that I think we would have to address. One final thing is we also have to look at the downside of that. If you're going to use graphic images, then are you going to perpetuate stereotypes? I mean, if you think about how Ebola was pictured, sort of in very harsh, vivid terms, and you utilize similar images, are you going to be perpetuating stereotypes about Africans? You know, are you? I mean, when it comes to traumatizing your audiences, especially young kids who might be either watching TV or might come across your newspaper, you know, how are you going to avoid doing that? So there are things that you need to balance out, and there is no clear, I think, cut answer when it comes to whether or not you should use these sorts of images.
That's very interesting. And still on that thought, maybe I'll just transition to Kipruto. And we have been getting so much information, even for me who sits in the newsroom, where people are saying that they no longer want news about coronavirus because it's just the same figures, facts, and then it's just us telling them about how the situation is getting worse, yeah? So are there other creative ways that we can use to tell stories about coronavirus? And Kipruto, you just pick that one. And maybe what is the place of satire? What is the place of different types of storytelling, like using cartoons to tell, let me just put quote unquote serious stories like a pandemic?
Hi, everyone. I hope you can hear me. As Marcia said, the whole issue on the corona pandemic has been covered in very, very serious terms. Most of it being asking people to take caution, to take precaution. Most of it to do with the grim statistics, how many people are getting infected, how many people are dying from this. But we've also seen how locally in our own country and in the region in particular, how some of our governments have mishandled this crisis. That is where cartoonists come in. Cartoonists, not just cartoonists, but other forms of satirical journalism. And I'll just mention a quote that the New York Times carried a few years ago after the Charlie Hebdo attack in Paris. They drew a cartoon on their front page and with the caption that without humor, we are all dead. And that is where cartoonists come in. They bring humor to very serious issues. They lighten up serious coverage of acres of serious coverage on issues. And I think our cartoonists have really been up to task, especially on things that are happening locally. I can't really speak on what other cartoonists across the world have been, but I can speak on what our own cartoons have been doing. They've basically been trying to, expose the ridiculous in how the government has handled the world pandemic while bringing humor to it. We've seen Gado and Victor Ndula of The Nation and other cartoonists try to lighten up these serious issues. For example, most of their cartoons have been based on, the policing surrounding this pandemic and how the police have been so brutal. They've even tried to bring the issue of politics. We've seen how the hand sanitizer has become more than a symbol for, keeping precaution, keeping safe from this virus, but also trying to cleanse the ills of our politicians. And basically how the government, the people responsible for handling this pandemic have been, issues to do with how funds have been stolen or mismanaged. So basically what cartoonists do is to, bring the humor and to expose the ridiculous.
Before I let Ngirashu speak, and Ngirashu, I want you to prepare to give us like maybe just a brief about your findings, because I know that you analyzed the coverage of the Big Four agenda between December 2017 and December 2018. So I want you to give us some of your findings, because the next discussion will be about how those findings can then direct us towards the coverage of COVID-19. But before that, I want to transition to you, Joe, and I want you to maybe tell us, just guide us on some of the things that you think we are getting right in the coverage of COVID-19 as the press. And then I also want you to maybe give us a little brief on some of the things that we need to do differently, especially when it comes to fatigue. We've been covering COVID-19 for now 4 months. And we've gotten so many people telling us that they are now tired of all this information about COVID-19. They just need to know what next, yeah? And then they are also, and then when you try to give them a little bit of politics, they write back and say, when you guys don't know there's COVID-19, you're telling us about what Raila and Uhuru are doing. So how do we balance that without exhausting our readers or our viewers, Joe?
I think COVID-19 has been, I think, the biggest, it's probably the biggest story the media has had to handle in the past 2 decades, in the Kenyan media. And in many ways, I think it has shown the strengths and weaknesses of our newsrooms. First, let me talk about maybe the strengths. It is quite clear that without a robust media, the government would have found a lot of difficulty mobilizing public opinion and awakening the population to the threat of the virus. Actually, the government seems to have relied solely on the media, yeah, and doesn't seem to have made a lot of effort on its own to design messages and basically just have targeted formal public awareness campaign There wasn't much of that compared to previous instances, a health crisis. For instance, I'm trying to remember, I was comparing that with the first outbreak, major outbreak of cholera in this country. I was a child then. And we all had these jingles and which we could all sing, and we all knew that it was about cleanliness and washing your hands. There seems to have been a gap in formal communication to the public, and a lot of it was left. It's really what came from Mutahi Kagwe's mouth and was amplified by the media. And that's you can't call that public awareness. And personally, I think that had a lot to do with this, the success of fake news on social media and in causing confusion. Now, in terms of coverage, media did a lot in explaining the nature of this disease and the pattern of infection, the spread. So basic information was there, but then you're talking only to the literate population. You're talking to people who have access to television. You're talking to people who can read on social media. A large percentage of the population got their messages late. And these are the people who needed it most. But when they got it, they embraced it. I was in touch with people in the rural areas. And when the message was finally getting there, that there is a problem and you need to protect yourself, they embraced it and they were more disciplined than people in Nairobi. But again, it only got there because of incidents like the guy who was being buried at 2 a.m. in Ukwala, you know, and therefore now it was, what is this? What is this nature of this disease? And then the chiefs went out to talk. So basically there was a gap, a failure in formal communication, and I think it is still haunting us to this day. Now, the media explained, the media communicated what government was doing, and I saw a great deal of attempt in the early stages to humanize this crisis, to put human beings at the center. This talk of fatigue, to me, is a commentary on lack of imagination. I thought we fell into a routine where we were reporting it as we would report all other health crises. Once in a while, there were flashes of creativity, but they were only occasional. So when you start getting complaints that we are fatigued, it means you are not surprising your audiences enough. You are not surprising them. And I was reading what was in the Kenyan media, and I subscribed to a number of American online media outlets. And the sheer range of topics that they would tease out, of the stories they would tease out of the daily happenings, was just amazing, very, very impressive. They pushed the frontiers far much more than we did. So part of the problem of fatigue, I think, has to do with the insufficient creativity in our coverage. We did the same thing and we're all doing something very similar, and the public at some point just decided, can you take us back to Ruto and Raila? Now, the other thing, the other problem was also on the accountability side, not pushing and trying to pin down the people who should be held responsible. People who are in quarantine would complain about being mismanaged, being taken to unhygienic facilities, but nobody ever asked the question I kept asking. Since a major plank of the failure of our corona management seemed to have been the quarantine process, it seemed to have been mismanaged, right from the identifying people at the airport to where you take them to the supervision. Why didn't someone ever ask who is in charge of the quarantine process at the Ministry of Health? Because it seemed to have been a pattern throughout. It's like there was somebody very senior who nobody could take to task, but they were not doing what they're supposed to do. They were bringing down the entire management. And I thought the media ought to have asked questions when there was failure, to try to direct questions at specifics rather than keep talking about the government. These are amorphous, Yeah. So people then got away. Yeah.
Joe, just before I let you go, there's one question. We are getting questions from people who are just coming in. And if you're just coming in, welcome to our webinar. Today we are discussing the coverage of COVID-19, from policy to satire to images of death. all those things. We are discussing how the media in Kenya and internationally has been covering COVID-19. And on our panel, we have Kenneth Kipruto from Standard Media, we have John Girashu, we have Patrick Gadara, and then we have Joe Dindo, who is a veteran journalist. And Joe, there is a question from Mercy Gaki, and Mercy is saying, it's very interesting that you've mentioned that we need to shock our audiences more. And they are saying by shocking the audience, do you mean we need to give them horror photos? Do we need to show the graphics?
No. In fact,
The graphic.
I think the media used that that issue of ethical compliance. They used that as an excuse not to be creative. Yeah? It is not about showing pictures of dead people, and it's not about naming people or stigmatizing people who have been unfortunate enough to contract the disease. It's about being creative in the angles that you tease out every day. Yeah? What new angle will I follow? Is it just chasing numbers on a daily basis? Is it just about looking for a cash scandal in the ministry? I could see what the Boston Globe was doing, and I was seeing what the Washington Post was doing in terms of just coming up with new angles. They just decided, for instance, to follow what is the experience of a doctor who is managing COVID patients. Yeah? What is the experience of a doctor who has been infected and then became a patient? Yeah? What is the experience of a mother or a parent or somebody trying to nurse a member of the family, nursing a COVID person? We ended up just floating around what the ministry has said, where there was panic, chaos in Ukwala. Personalizing this thing for me would have made a very big difference, even in terms of impact with the public. Because one of the problems we are having, as far as public discipline is concerned, is a failure by Kenyans to appreciate that this thing is about them individually. It affects you as a person. And you don't have to illustrate that by showing the body of a dead COVID patient in Waitivie. You don't have to. It's about telling stories which they can identify with and say, this could be me. This could be me.
Could I just very quickly, I know Girash is waiting to speak, but on the use of graphic images and this sort of gory images, I think we have to be aware that they do have their place, that it's not just a case that you come up and you say, we are never going to use them. You know, one of the problems that has been faced, I think it's across the world, is how do you communicate the gravity of the situation with regard to COVID? And unfortunately, when it comes, lots of the reporting has been done using statistics and using graphs. That's what people actually see. You see an image of the virus itself, but not what it actually does. And there's a kind of inverse relationship between the scale of an incident and people's ability to comprehend it. When you speak of huge numbers, people are unable to actually personalize it, as I think Joe was saying. So it's important when people actually see what is happening, what the virus is doing, they can start to empathize with individuals, and they can start seeing that this is real. And it has been shown in various studies that, for example, when you're dealing with health communications, that when you use high impact, high visibility images, that this can actually shock people into complying with health advice. You can think, for example, about the use of graphic images on cigarette packs. And that has been shown to be much more effective than simply using a text warning telling people that you might get cancer. If you actually show the picture, then people become much more aware of the danger and they take it more seriously. It's the same thing with other health communications, which is why at the beginning I said the media has to decide whether it's only going to portray the situation or does it actually want to be part of influencing how people respond to what it's reporting.
Thank you so much. Let's put a pin on that because that's a discussion that's also, there's also a chain of questions coming around that. But before we go on whether to use more graphic images or not, let Ngirashu tell us what he found about the coverage of the Big Four agenda in the span of 1 year. And then from that, we can maybe be able to see some of the failures that we had when we were covering the Big Four agenda, and then maybe transfer that knowledge on the coverage of COVID-19. So Ngirashu, maybe you can tell us?
Yeah, thank you, Mercy, and good morning, everybody. So I carried out a study on newspaper coverage of the Big Four agenda in the first year of the Big Four agenda's existence. That's between December 2017 and December 2018. That was 1 year. So the study was inspired by another study done by InfoTrack, which had established that 1 year after the launch of the Big Four agenda, 53% of Kenyans, that's a majority, did not know about it. So I went to find out why that was the case. And so I looked at the two news coverage by the two newspapers, the Daily Nation and the Standard, over 1 year. And in a nutshell, I found that the media was very enthusiastic to cover the Big Four agenda. But then it was frustrated by a lack of information. And this ended up with the majority of Kenyans lacking awareness about the government's key objectives. The issue that was also most evident there was that the government does not have a history of clarity in the development and communication of its agendas. So during my study, I was told by journalists that while they wanted very much to find out about the Big Four agenda, they did not have enough information from the government to write about it. They would often find that ministers, cabinet secretaries want to be associated and their project to be associated with the Big Four agenda, but could not provide any substance beyond merely talking about it. So I think, and from that I could see the government sometimes really struggled to communicate its policies and to explain why it is doing certain things, why some things are being prioritized over others. And when it comes to coverage of the coronavirus, of the pandemic in Kenya, I think a lot of it has been hampered by the government's own inefficiencies in communication and its own bureaucratic tendencies and bureaucratic tendencies in democratizing access to information, which is why, as Joe has rightly pointed out, this responsibility was placed on was handled by the media, and it then did not demonstrate imagination and creativity in doing that. Think about when when the government decided that the Ministry of Health decided that we can now show Kenyans the first people to recover, to get infected and probably to recover from the coronavirus. And you will recall how it spiraled into some sort of, it became a farce. The case of, is it Brenda and Brian? And they literally dropped out of coverage, and the coverage then became too much, and to a point they started especially Brenda started contradicting herself, and you saw how that spiraled out. And you see when now that happens in government, is the officials now want to hold back, because whatever they've tried on day one has backfired on them, and you thus can't get access to patients, people who have recovered, doctors who have been infected. And then it took quite some time for the coverage to now resume, sort of the coverage of the patients, of the people working with the doctors to resume. so that we then saw the media going back to what I'll call tropes, the controversy. Is it the doctor who was suspended? Is it the fight between Kemri and the Ministry of Health? And I think the lack of imagination, the lack of creativity that that Joe pointed out then was because of a lack of access. And that access could only have been given by the Ministry of Health and the people who are handling the patients. So it's the same issues that we see in the coverage of the Big Four agenda. You have an enthusiastic media, and I think the health reporters have done quite a good job of informing Kenyans about this, but then the gaps in implementation and sort of the good old corruption, like we've seen in the police manning the roadblocks, then get in the way of communication. And you also have...
Maybe if I can just stop you at that and then add another question that's very related to that. There is an interesting question that has come from Augustine Gitonga, and Augustine is asking, what is the role of the media in communicating issues about COVID-19? And the reason why I'm saying it's related to your study is because you are looking at the Big Four agenda, and you're looking at the role of the media in covering the Big Four agenda. So if the government, for instance, has this plan that they're doing and all that, is the role of the media to propagate that and tell people what the government is doing? Is the role of the media to interrogate that? Is it to critique? What is the role of the media when it comes to development? And then now you can tie it also, what is the role of the media in the coverage of COVID-19? Are we supposed to interrogate, and it's been a very tricky balance for people in the media. You see that a lot of funding has come in. You're wondering, is your role to praise the donors and tell them you're doing a good job in helping us? Are you supposed to interrogate the government on how they're going to use this funding based on the fact that, they have had cases where they misappropriate this fund? So what is the role of the media in all this?
The role of the media has not changed for me. It's a platform for the education and information and entertainment of its audiences or society. I don't know much about entertainment during the coronavirus because that's a whole, I think, different area. But information and education with creativity, with imagination is what I think the Kenyan media should be doing. The tricky thing with coronavirus is that it's an evolving situation, and from all accounts I've seen, these are very sort of unpredictable virus. So I think the role is limited to that, information and education. Now, when the government rolls out measures, like now it has eased the restriction, I'll take the role of the media being to inform people, that has been done, educate, and education in this case will be explaining from the policymakers. This is what the policymakers have said to the audience. And we also have the media providing a platform for ideas, a clearinghouse for ideas, so that those who are critical of the ideas are given, an opportunity to speak about it, to elaborate why they are critical of it, to suggest other options. And the government and the policymakers are also listening and also read whatever is being published or being broadcast in the media. So I see it as a platform for the information, education of people, and also for debate, to enrich the policies and to enrich the information that people have around the coronavirus. As Joe has said, I don't think there's a place for gory images or for things that need to shock the audience. But I think that if the audience is educated, is informed, the word can go out. I found out in my study that while newspapers in Kenya, the circulation and readership has gone down, they still retain a significant agenda setting role, where I'll read the paper and I'll go and meet a bunch of my friends, maybe some who haven't, and I'll explain to them, I'll give them information based on what has happened. We see newspapers still being read by TV anchors in the morning, radio broadcasters in the morning, and they then become a source of information and education for the people. Yeah, I hope your question is sufficiently answered.
Yes, and then there is also, we had put a pin on gory images, which is a very interesting conversation, yeah? And there is someone in our newsroom who has sent me a very interesting question for you, Gadara. They are saying, we experienced mass death in Italy, yet we didn't see the gory images. So do Africans have to be the only ones who get scared using gory images? Are they the only ones who can be educated using gory images? Because when we were covering Italy, even right now in the US, there are so many people who are dying, but you're not seeing those gory images. Does it mean that Africans are the only ones who are conditioned to learn through gory images? That is for you, Gadara.
Okay, sorry, I'd muted. I mean, it is a good question, I think. I think it's a valid question. But again, he's got to be aware that you did see lots of images of dead bodies coming out of Italy. You look at the US, there's, in fact, there's an article that was published by these guys, they're called Reading the Web. I forgot what their name is. But anyway, they monitor the use of images by US press. And they're saying that in the last 16 years, they have not seen this level of showing of dead bodies. Now, obviously, the context within which they show them is very different from how they're shown when, for example, they're reporting on Ebola. So in Ebola, they're really stark and really sort of, you can see an uncovered dead body, for example, in a way you wouldn't see it, for example, in the US coverage. But for example, in Italy, you had pictures of bodies being thrown on the street. So it's not the case that it wasn't. And the thing is actually the fact that they were publishing these images is what is bringing home to people the direness of the situation, that it is this bad. You've seen similar pictures in places like Ecuador, in Brazil. All I am saying, I'm not saying that go out and publish all the bad pictures you can lay your hands on. I'm saying you've got to start thinking about whether they will play a role in the coverage. I think a situation where you say we will simply not use them is not helpful, because then you're disregarding some of the benefits that can come from utilizing these images, especially in getting people to understand the gravity of these situations. And as I've said before, that there is precedent even within Kenya for using them. You remember, just to repeat, during the 2007 violence, that editors got together and said, we've got to show this so that people can say, that this violence is taking a really bad turn, and try and shock them into stopping. So I think there is precedent for that. Yeah.
I think you've covered that, and I'm going to go back to Joe, and there is this thing where there are people who are saying coronavirus is not real. Perhaps it's because maybe they haven't seen those gory images and all that. And in our newsroom, we're battling with this thing where we're asking ourselves, do we need to go to Mbagathi and show them, videos or photos of people who are dying or people who are extremely sick? But then you also have to understand that coverage of COVID-19 is very tricky also in the security or safety of the journalists, because you don't want to get exposed to the virus just because you want to prove a point to people that this thing is real. So Joe, if you were in a newsroom today, would you have sent me to Mbagathi?
Yeah, at least one thing we would have agreed on if I was in the newsroom today. Can you hear me? One thing we would have agreed on is that we are not doing enough to awaken people to the reality of COVID. And I would have asked myself, what do I do? I think I would look at what are the what I will call it, what are the touch points of this skepticism among the public? One, people are inclined to dismiss it to kind of support their indiscipline. So they find it difficult to wear masks. They find it difficult to keep social distance. So they're looking for justification. So we must not give them room. And what I would have done is looked at one. Right now there's talk, for instance, that the hospitals are full. You can talk with the government and the ministry and explain your purpose and tell them, look, can we go and take a picture, a long shot of a ward in at the Aga Khan or at Kenyatta, and just say, this is a COVID ward. There's not a single bed empty, yeah? And these are people outside who are waiting. They are being treated, but they've been told to go back home. This is a hypothetical situation, yeah? You can work with the government, and it's not just, don't just give in to the restrictions. If you explain your purpose, you actually get support. I agree with Gadara that actually there are times that you need to stretch the ethical bounds for impact. We all know that when the war, what do you call it? People escaping from war in the Middle East and from Iraq and from Asia, going to Europe, were being locked out. It took one picture of a dead body on the lake, on the seashore somewhere in Italy or in Europe or the Mediterranean for Europe to change its view. When that picture was used, I'm sure editors grappled and asked themselves the ethical, whether it was ethical to do so. And almost, I think 70% of media found a way of using that picture. But that picture changed the entire discussion about immigration into Europe. So there's a place for what we would call gory pictures. It should not be a daily thing. It should not become the routine. But in instances when you are trying to save lives, I think there is a justification for it. So I would have sent you to the wards. I would have challenged you and your photographer to find a way of actually showing us maybe the inside of the mortuary without showing us the close-up of the bodies. Yeah, okay. But Kenyans need to be hit hard.
All right, and then there is also another question that's coming from Agnes Ainea, and Girashu, I want you to answer this. Ainea is asking about the role of entertainment in the coverage of COVID-19, and so far we've seen that when even in our own newsrooms, when people are going to discuss COVID-19 stories, the entertainment guys are told, you'll be called later. This is now serious stuff. It's serious stuff. It's health. Reporters come here. We need senior political reporters. Entertainment guys mutaitwa. So what is the role of entertainment, Girashu, when it comes to the coverage of COVID-19?
It's a tough question because I'll be, if I were in the newsroom now, I'll probably be among those who are being called in as political, as policy reporters, to cover this important, very important thing. But the media also carries a platform for entertainment, and one of the good ways you can reach people is by packaging that stuff, inside that information inside the entertainment. Okay. Joe was complaining earlier that there was a lack of jingles, communication in the form of music and that sort of thing in the past. And perhaps now that is the role that the media can play now. There's one song that's been playing in the adverts, a kid, Osha Mikono, that sort of thing. So perhaps in my thinking, and a bit conservative as far as news coverage goes, I think entertainment would play the role now of informing people in a very accessible manner. When something is put to you in the form of a story or a song, and songs often tell stories, you get it almost immediately. I think that's where I'll place it. But I believe in educating the people who can make an influence and who can then go on and spread the message. Remember, we in Africa are a very oral society. Oral literature plays a big part in the passing on of information and history in our society. So aligning things in that direction in the form of the news and mostly radio, I think works for me perfectly.
And then Kipruto, you're too quiet. So my next question is for you. So we are still on the issue of ethics, yeah. And there's some people who believe that cartoonists have a free pass when it comes to ethics, and they can just do anything, and then they say, it's a cartoon, get over it. So what's the place of ethics in cartoons? And then there's also another question here, still on ethics, that someone asked about the exposing of the driver and his vehicle registration number. Was that ethical when we were covering about people who are trying to sneak out of Nairobi? I think there was someone's registration number when he was trying to sneak out. I don't know if I got that right. Was it ethical? Where do you balance ethics and truth?
Well, let me speak a bit into entertainment, entertainment question. I think cartoonists go beyond their call to, in the line of duty, in the bid to satirize happenings, the news. They bring the aspect of humor, and they bring out, they expose the ridiculous, and in so doing, they entertain people. Most readers, when they flip through the newspaper, from page 1 to page 14, where the editorial cartoons are published, before then, everything that comes before that is normally made up of serious things happening. But when they get there, they'll get a laugh. They'll have a laugh. They look at things that are happening, but see the funny side of it. As to the question of cartoonists having a free pass as regards to ethics, I don't think that is true, because we have a role. The media has a role to play, and most times a cartoonist will go through a cartoon will go through the very same editorial standards that any story, be it TV or be it print, is subjected to. So there will be a line of gatekeepers making sure that they do adhere to the ethical standards.
We have less than 10 minutes to wind up. So in winding up, I want us to look at maybe the way forward. So what next after we've said there's some things we are not getting right, and I know Joe has given us some insights on some of the things that we need to do. So for you, Gadara, I want you maybe to tell us just briefly on some of the emerging trends that we are seeing in cartoons and graphics. And then Joe, I want you to be simmering in your mind about the future of journalism. You know what's going on in media, so let's also tackle that big elephant in the room. So what's the future of media? Will we survive after COVID-19? So that's the question that I want you to talk about. And then Kipruto, I want you maybe to think about other spaces. What is the other space that cartoons have other than in newspapers? What are the other spaces that cartoons have? And for you, Ngirashu, I want you to maybe talk about some of the digital technologies that government or policymakers can use when it comes to reportage of maybe COVID-19 and other pandemics. So let's start with, who looks ready? I'll start with Gadara.
Okay, I hope you can hear me. I think my internet has been acting up a little bit.
We can.
Well, I think, well, to begin with, can you hear me?
Yes.
Okay.
Yes.
To begin with, I think if we talk about the cartoons, I think the cartoonists have a dilemma here. Because there is a sense in which you're both trying to elicit a laugh from people and to get them to take the people you're satirizing seriously. So if you're showing up government to be doing all these silly things, and getting people to sort of ridicule them, and then still saying you need to take the advice that she's giving you seriously, then you've got a bit of a juggling act to do. And I think many cartoonists are finding it a challenge to sort of navigate that. The second thing is when it comes to the role of being a public educator, telling people what they should or should not do, is not really a traditional role for cartoonists. So I think they'll struggle with that. Just looking forward, I think just like to mention two things. First is newspapers need to prepare. You've seen how COVID has ramped up in other countries, and we should really assume the same is going to happen here. And you really need to prepare. How are you going to cover it? I think when it comes to ethics, they need to start training people to make ethical decisions. So to take them through models like the Potter box, etc. There are several that they could use, but to make sure that the people who are sitting down to make decisions about what to portray, what to use, what pictures to use, what sorts of angles to take, are able to do so while considering the ethical implications of what they do. It's not something that our newspapers have done to date. And this is actually a problem that is much more magnified when you talk about reporting online for your online editions, which don't really have the time to sit down and have meetings, etc. So it's really important that you start doing that now. And one of the ways you could do it is to start wargaming this, is to start saying, what if we have 100 deaths? What if we have 200 deaths? How will we cover it? And to start actually helping people to practice how they might approach these things before we actually get to that. Yeah.
Kipruto, maybe you go next. And there are also we have some students who are listening to the webinar, and we are always looking for innovative ways of doing things. So if you can just tell us what the other platform that cartoonists can use, or illustrators, or people who do graphics. We can't hear you.
Sorry about that. I was muted.
Okay.
I would say they should take advantage of the online space, as Gadara said. And remember, part of the reason circulation numbers are going down is because of the online space. And most cartoonists are actually very popular on Facebook and on Twitter, and that is where most fake news is propagated around. So I think in the digital world, cartoonists have a wider reach than they do in the traditional media forms.
Okay, so we kind of lost you a little bit there, but we got a gist of what you're trying to say, that they need to explore the online spaces and all that. So Ngirashu, before we go to Joe, some of the digital options that the policymakers can explore.
Yes. Once again, it's yet another tough question. But with communication, I think the way to go about it is to analyze your audience, understand the people you're trying to reach, and use the right channels or the channels that would be most efficient at reaching them. We have opened up boundaries. We have eased the cessation of movement, and I think we need to think about our rural audiences, like now, for example. And for those really, we might talk a lot about in Nairobi, all manner of digital options, but for them, radio is a key resource. Regional TVs and community radio are a very excellent way of reaching them. We need to think of the people who have maybe limited access to data, so that even if we send them messages on WhatsApp or videos or creatively done things that we can post on all manner of digital channels, are they going to get it? Or is it better if that information is given to them, audio on radio and that sort of thing. With the urban audiences, the good thing about urban audiences, we have access to all manner of things, smartphones, we have apps we can log on to. Some have subscribed. There are studies that's been done on how social media apps are being used in the different age groups, and that information will be very useful in packaging the information for those audiences. Like I noticed with my own kids, you put something on TikTok and they'll sing it through and through. You put something on a YouTube video or a channel for kids, they'll get mad. So we need to be creative, we need to know what we have available, and you have to tailor the communication to the audiences.
Okay, so Joe, this question that almost every journalist is asking, and we have people who've just joined AKU because they want to become better as journalists, and then now here we are in newsrooms being told that you're no longer needed. So what is the future of journalism after COVID-19? Will we survive this thing? And if we do, what do we need to do differently so that we do not go under, or so that the next pandemic does not wipe us out completely, not by killing us, but by killing our newsrooms? So Joe, what next?
Yeah, I think what the pandemic has done, the pandemic is not killing media. What the pandemic has done is to hasten a transition that was long overdue. Revenues have been falling because of digital disruption. And in other parts of the world, people have awakened to this reality and said, look, media has to change to the new world. Media has to change. It has to align itself to the new, to the new generation of news consumers and their habits. They are digital creatures. When we talk about media, we are referring to print and television. In Kenya, what this has done, what the pandemic did was to wipe out revenues overnight, circulation revenues, because there were no people to buy newspapers out there. Advertising revenues, advertisers canceled. They didn't think they would get value for their money. Well, this happened in the rest of the world also. But in a situation where revenues were already falling, the impact was felt immediately. Nation and Standard lost nearly 60% revenue, circulation revenue overnight. Yeah? And it happened on television as well. Now, this is what was happening, but in a very slow process. And it lulled the media into some kind of sense of false security that we still have many years to go. The need for reorganizing yourself in order to cater for a new generation of news consumers was imagined about 5-6 years ago, and people have been delaying. And that's why when you talk about convergence, people start talking about an animal. When will it happen? When it will happen? They don't realize that it is a process towards, which enables you to cater for the new audiences. What media now has to do, and there's no going back, they have already scaled down their staff numbers. Now the question is, how do you reorganize yourself? Now what they're trying to do is to save costs because they lost money. Now they must also now ask themselves, how do you create value? Now there are only two ways they can do it. They can either sell content, yeah, they can find ways of getting money from their audiences, or they can diversify also on digital platforms, find new sources of revenue. Now that's an urgent task, because you cannot survive by just cutting down your costs and getting rid of people. In fact, my own sense is one of the things that's going to happen once the media reorganizes itself into being a robust digital operation and begins making a little money from digital, they're going to bring back many of those journalists they've gotten rid of. The experience has been with the Washington Post and New York Times and even the Guardian is that you need many more competent journalists to generate good content. If you are selling content and relying on content as your source of revenue, they'll have to bring those people back, but it will take a bit of time.
May I just quickly ask something from Joe? with regard to the coverage of COVID-19, if, as we are seeing, newsrooms are being, journalists are being fired, and so you don't have many people in the newsroom, and you've got this pandemic that's ramping up here. Do you think our media is actually poised, is going to be able and capable to adequately cover COVID-19 when it properly hits us?
The weakness, or rather the diminished strength of our newsrooms will become obvious when we hit the peak. That is one. But when we also settle back, and there will be many other stories they have to cover. But as being businesses, it will only become an issue when they realize that they're trying to make money from content, but they can't make it because they are not generating competitive content. The quality is not strong enough to be bought. Being businesses, that is the line that will now finally awaken them. We may not worry so much if they're not able to cover the peak of the pandemic adequately. They will only suffer criticism from people like you and me. Yeah. But the nation will get away with it because they are they're dominant in the marketplace. But when now they realize that they need to show their shareholders an increase in revenue, and they can't do that because they don't have a competent health reporter, they need to recruit a top-notch crime reporter, they need to bring back Macharia Gaido for the sake of, because you need now a team of big names for commentaries, because you want to sell commentaries. Then the whole discussion about investing in talent is going to change.
Yeah, thank you so much. It's been very interesting, and there is because that's one question that most people had asked: what next for the media? And I think Joe, you've summarized it very well for us. There is street lingo where they say ujipange ama utapangwa. So basically, by you telling us that we have to reorganize, you're telling us that tujipange ama tutapangwa, and that's a very good note to end in. So thank you so much for joining us. This has been very insightful. I have been moderating, and I can tell you for sure that I've learned so much. And let's continue having this conversation even offline. So thanks so much for joining us.
Thank you, Mercy. Thank you, everyone, and all the panelists. Thank you to everybody who joined us today for this webinar. It was extremely insightful. The conversation was great, and we hope you found it valuable and it stimulated your thinking. We'll be back over the next few weeks with similar webinars to contextualize research and connect it to the newsroom. In fact, specific topics around the future of media and journalism have actually been researched by some of our students, and we'll be covering those with future webinars. Until then, applications are open for the next enrollment of the Master of Arts in Digital Journalism with AKU. So equip yourself with the skills for the future of journalism and join the program. Thank you and happy Wednesday.